So I'm Felipe Lobelo. I'm a preventive medicine doctor and I work at the Emory School of Public Health, the Hubbard Department of Global Health, and I direct the Exercise Medicine Research Center. The mission really is to evaluate the implementation of the Exercise Medicine Global Initiative, which in a nutshell is trying to make physical activity part of healthcare. Really, when you think about main risk factors for chronic disease and mortality around the world, inactivity has been sort of overlooked. And what we're trying to do here is to make sure that physicians and healthcare systems assess patients' physical activity and provide some recommendations or counseling to help them improve physical activity and, as a result, improve their health. Absolutely. So we see mHealth and patient-generated data as really critical to the implementation of the Exercise Medicine Initiative. For the last few years, some healthcare systems have started implementing physical activity questions in their electronic medical records. But as many of you know, there's a lot of action around using wearable devices to objectively measure people's physical activity level. And some health systems are starting to pilot test the implementation of this data to guide clinical counseling. Now, these are really early stages in this period, and there's a lot of questions. We typically refer to this as the Wild Wild West of mHealth because issues around validity and privacy and interpretation of the data and interoperability are really at the crux of making this routine care. Yes, there's a number of initiatives and groups that are actively working to solve some of these issues and to improve not only the quality of the data, but also the use of it. So in terms of the quality and the standardization of different devices, there's a number of projects going on that are trying to essentially assess the mean error. Which devices are more accurate than others. There's also different use cases. Depending on the clinical population, you may want to choose one device over the other. There's really no central repository of this data or these recommendations, but the American College of Sports Medicine, the CTA standards section, the American Heart Association, and others are actively working to solve some of those issues. At the end of the day, like any other measurement in clinical care, in medicine, it's not going to be perfect. There's going to be some error. But we think that at least the process needs to be streamlined and sort of critical aspects around data standardization need to be in place. Yeah, so I was lucky enough to connect with a group of brilliant students that had a passion for this area and also the knowledge and the expertise to at least start to solve some of these problems. So one of the issues that we have is that there is sort of a bring your own approach to patient-generated data. In some cases, a clinician may want to prescribe, if you will, a certain device to assess activity. But for the most part, this is a consumer-oriented industry, and patients are going to have a device, and they want to have that data provide some or be taken into account with clinical counseling. So the main aspect of the project that the students worked on was to try to integrate different sources of data from different devices into the electronic medical record, and also make sure that the critical, useful aspects of the data are being presented to the clinician in a simple way. Because as you know, these devices collect a lot of data. There's a lot of noise. And you really want the meaningful use aspect of this to become what gets integrated into the EHR. So that was the main objective of that project. Yes, so essentially the students were able to capture the data on the back end of a few wearable devices that we identified as being accurate and appropriate for these different use cases in lifestyle medicine and counseling. And then we made sure that the data was transformed in a way that was connected to public health guidelines. Typically these devices collect steps, but the recommendations from the CDC and other public health organizations are not really around steps, are around minutes of physical activity per week. So we made a transformation, or the students worked on transforming that data from different metrics, steps, into minutes of moderate to vigorous physical activity, and draw a line or set the standard for what is the appropriate weekly dose, if you will, recommended by public health organizations, and make sure that that visualization aspect of the data was clear, as we intend to migrate this data into electronic medical records. So here you can see that once the data is being captured from the back end of the wearable device that we selected, then it needs to be transformed from the metric that the device uses into minutes of physical activity per week. And then you have daily data being captured. And then you have to combine the daily data into a weekly metric, because the volume of activity per week is the recommended public health guideline. So when you combine weekly data or daily data into a weekly standard of 150 minutes of moderate to vigorous physical activity, then you can see a line that essentially helps the clinician identify if for that week that patient met the recommended dose of activity. In addition to the total dose of activity per week, you also have the intensity of activity. So again, the recommendation is for 150 minutes of moderate or vigorous exercise or physical activity. And in essence, vigorous minutes count twice. So as part of this project, the metrics need to be adjusted so that minutes of moderate intensity activity are combined, and you can see here in a different color, with minutes of vigorous intensity activity in order to come up with the recommended public health metrics. So using different visualization aspects, colors, a threshold line that helps the clinician identify what's the dose and whether that patient is meeting that dose or not, should be able to simplify the process of interpreting that data and leading into the counseling that the clinician can provide to that patient. My pleasure, Mark, and thanks for inviting me to work with this class and your students. It's a great opportunity to combine different expertise and issues around the interpretability of mobile health, and looking forward to working in more of these projects.